From the California State Senate, this is Senate Spotlight.
Hello, everyone, and welcome to this segment of Senate Spotlight, where we discuss legislative priorities, policy, and other related issues with members of the California State Senate. From the state capitol here in Sacramento, I'm Brian Green, and joining us this time around is our state senator from Sacramento, Dr. Richard Pan. Welcome back. Good to see you.
Good to see you again, too.
Glad to have you here. Let's want to talk about a lot of things that have happened this year. 2015, what a year, right?
Right. Well, it's very exciting.
That'll be the first question. Yeah, it was pretty exciting, wasn't it?
Very exciting, yes.
You've had a lot of legislation. You're a pediatrician, a former college professor. Right. You've sort of are building that bridge as a lawmaker and a physician, and you've done that in a number of ways. And we'll talk about a lot of those pieces of legislation where those two priorities converge. First, let's just talk about the big one that everybody knows about from this last year. Certainly one of the more controversial bills at the Capitol this year, and certainly one of the more impactful bills that you could say really in a generation, and that was SB 277, the vaccine bill, which of course abolishes the personal belief exemption requiring vaccines for school attendance. Give us some of the details on this and how things finally finished out as the governor signed the bill.
Well, as you know, we had a measles outbreak here in California, and that outbreak didn't just start in one place and stop. It continued to spread. And that basically was a sign to us that we needed to restore our community immunity. And yes, the hearings were packed. They were contentious, but I think the facts have always been very clear to my colleagues in the legislature and also to the governor that we need to raise our vaccination rates to restore our community immunity, something that we've actually been able to enjoy for several decades thanks to vaccinations, and that we need to get that back. And so the bill passed out both houses, went to the governor, and the governor signed the bill, and it's now law. There was an effort to overturn the bill through a referendum, which actually was far short of qualifying, indicating the strong public support there is for vaccinations and ensuring we stop preventable contagions from happening in our state.
Well, I suppose if your children are vaccinated and they're going to school, this bill really doesn't directly affect you, but in some ways, obviously, it does, because your kids are safer, they're healthier.
Exactly, and I think that the part that we need to keep in mind is that what we don't want is we don't want to have these dangerous contagions in our community. When that measles outbreak happened, you had stores having signs saying that if you went to the store, you've been exposed to measles. You had read news reports about if you rode public transportation, the BART, you were exposed to measles. That if you went to a restaurant, you might have been exposed to measles. And even if your children are vaccinated, you may have an infant who's too young to be vaccinated. And there's families who had children who could not be vaccinated because they might have been allergic to the vaccine, or they had cancer or a transplant. And we need to protect everyone in our community. And even when you're vaccinated, you don't want to be exposed to these diseases anyway. So by having enough people vaccinated, it keeps the diseases from actually even being in our community in the first place. And isn't that what we want?
And are there any exemptions specific? I know you've removed the personal exemption, but
so
is there anything else?
Right, exactly. There is an exemption if there's a medical reason you cannot receive the vaccination. And as I mentioned, some people may be allergic to parts of the vaccine, and of course they would. Or they would have a medical condition that would not allow them to respond to the vaccine. Those will all be reasons, medical reasons not to be vaccinated, and we acknowledge that there are going to be people who cannot be vaccinated because of that, and they depend on the rest of us. The rest of us to be vaccinated to protect them and to prevent these contagions from spreading.
What's the reaction been now as school has started this year? The kids are back in school.
Yes.
Are the schools notifying their communities, their student bodies? Are we repopulating the herd here this fall?
Well, we will be doing that starting next year. The bill takes effect essentially on July 1st of next year. I've had so many people come up to me in my own district and other places in California thanking me for doing this bill, because they don't want to see these dangerous diseases return to their community.
Well, Time Magazine has called you like a vaccine hero. They put you up there with Jonas Salk, so you're in distinguished company. And I know you're just doing your job, right? But I mean, that's quite a distinguished acknowledgement.
Certainly, I appreciate the honor. It was a team effort. I want to thank all the parents who came out to support this bill. We had the state PTA, Vaccinate California. Those parents are the ones who called my office and my colleague's office saying, we need to do something. And it's because of them that we were able to do this bill and pass the bill, and it's because of them that people know why it's so important that people should be vaccinated. It's really the parents of California who say, we want our children to be safe, we want everyone in our community to be safe.
There are still parents out there, though, who have children. There are hundreds of them. We saw them at the Capitol this summer, who say their children were harmed by the vaccine-induced autism. They're still very much opposed to this law and this notion. They don't trust government, especially dictating to them about health care and education, that there's big pharma, there's all of this. What do you say to them? They're still out there. You can't neatly tie this up and move on. There's all these folks out there that still have this reaction to this legislation.
Well, first of all, I would say is that this legislation still allows parents to choose whether they want to vaccinate their children or not. There's nothing in the law that says that you're required to vaccinate your children. There is a consequence to that. And that consequence is there not to punish those parents, but to protect the other children. And I think we need to recognize that. Vaccination is not just about the individual who gets vaccinated or not vaccinated. It's about the community. The goal of SB 277 is to restore community immunity so that we don't need to see signs in our community, in our businesses, in public transportation, in our schools, in the newspaper, that people in our community have been exposed to a deadly disease. That is not the kind of world people want to live in, where you need to worry that if you have a newborn baby, that they may have been exposed to something that could put them in the hospital or kill them. That measles outbreak hospitalized over 20 people. That's serious. We have pertussis outbreaks where infants have died. That's serious. And people don't want to see that happening in the community. And that's really what this bill was about, is restoring that community immunity. And so certainly there are parents who may not trust government, who don't trust, and they will still have the choice. I would urge them, though, to look at what the facts really are. Vaccines are much safer than the diseases they prevent. Vaccines are effective. In fact, they're so effective, that's why we've been able to enjoy for decades the safety of not having the disease in our community. But as our vaccination rates have fallen and the number of exemptions went up, that's when we saw outbreaks of pertussis, of measles. Now, let's not have that return back to our communities. And that's what this bill is about. That's why the parents called my office. That's why parents stood up and said, enough is enough. We need to do something. And that's what we did this year.
Well, your whole legislative agenda, your priority here in Sacramento is building healthy and safe communities.
Yes.
And obviously you've done so much more legislatively than just the vaccination bill. And let's talk about some of that other legislation. I know you are in particular involved in the special session legislation regarding the tobacco tax and also the e-cigarette legislation clarifying it is tobacco. Let's talk about the status of that legislation. Those bills failed, if you will, in the policy committees, but in this special session on health care, they've seen some new life. Talk about what these bills do. This would be the SB 13, the 2X, right?
So one of the things that we looked at is that California used to be a leader in tobacco cessation, and we have fallen off from that. The fact is that when we look at California and the states that surround us, we actually have the lowest tobacco tax of any state that surrounds us. We also know that the research shows that when tobacco taxes are higher and the cost of tobacco is higher, that discourages youth smoking. And in fact, if youth don't start smoking, essentially between their mid-teens and early 20s, they're unlikely to start smoking after that. That's the time when people are most vulnerable to starting to smoke. And once you start and get that nicotine into your brain, it's very hard to stop. And there are so many people who I know who are smokers who wish they could stop, and it's so difficult to have that happen. And so what we've proposed is a $2 per pack tobacco tax. One is to actually discourage smoking and decrease youth smoking. And the tobacco companies know this as well. And so, of course, they are strongly opposed to the fact that we're going to cut off potentially reduce a generation of future customers for them. And the other part is that the cost of tobacco-related disease is actually many times greater than the tax that we're going to collect even with this tobacco tax. So one person asked me, said, well, what would happen if everyone quit smoking and then you'd get no revenue, right? You get no revenue from this tax. And I said, that would be fantastic. That would be fantastic not only for the health of California, that'd be fantastic for the taxpayers of California. Because tobacco-related disease costs about, I think, $8 billion a year to the taxpayers of California. And we think tobacco companies should do a little more of their share to help pay for that. And all we're asking for is essentially about $1.5 billion of the $8 billion that they should pay into it. And that's what that $2 per pack tobacco tax really represents. And certainly those revenues were going to be committed to actually helping improve access to health care, including tobacco cessation. And so I think that's effective use of the money. Unfortunately, it was not able to get out of the special session at this point in time. However, the coalition that's supporting this is looking at doing an initiative, and we'll see. Hope maybe we can come to a final agreement before the special session actually closes out.
And I know some of those young people that would be smoking cigarettes are now vaping e-cigarettes.
Yes.
In fact, some of those folks who are using the e-cigarettes say that it's saving their lives because it's helped them with smoking cessation. Now, the FDA hasn't had any regulations on this. I know you and Senator Leno have tried here.
Right.
What do you want to do with this here as part of this legislation?
Well, certainly, e-cigarettes contain nicotine, which is a tobacco product. It only comes from tobacco. I would also point out that while e-cigarettes may have been used by some as smoking cessation device, it's not been proven, demonstrated its effectiveness as that. But more importantly, we see a rapid growth of the use of e-cigarettes by youth. And again, it's about trying to get nicotine into the brain at a very vulnerable time to then get people hooked onto using tobacco products, whether it's e-cigarettes or cigarettes. And in fact, more recently, research has shown that a use of e-cigarettes is likely to lead to use of regular cigarettes. So I think we need to treat e-cigarettes as a tobacco product. They are a tobacco product. The liquids that are used in them are from tobacco. And to be honest, that's really what we should be doing.
You have also authored legislation that will help farm workers and agricultural employees with their ongoing medical costs. This puts money into the RFK fund. Tell us about SB 145. And I know you just had a press conference about this a couple of weeks ago. Big deal for farm workers here in California.
It's a big deal for farm workers, and it's a great deal for taxpayers, because farm workers have a plan, the RFK plan, in which they and their employers pay into. Now, this plan, because they're low income, was not able to immediately comply with some of the ACA requirements requiring that there not be any limit in coverage, and some things that I think are very important that we protect. And so what we're doing is we're actually creating some time for transition to basically provide support for the plan for these low-income farm workers to be able to continue to have essentially a private plan and achieve stability in the plan over time that will allow the plan to stand on its own. Now, the alternative to this is that if we decided not to do that, and this bill did not pass, and we decided not to do this, then the farm workers would lose their health plan and then would be forced into the Medi-Cal program, which would actually cost taxpayers more money because essentially now the taxpayers are on the hook for the entire cost. Instead, we're helping support a plan that is transitioning over time, and that also ensures that these farm workers get private insurance.
You have held hearings this last year with you and your colleagues the last year or so on the Denti-Cal program here in California, and the auditor's report saying that a lot of these folks that are signed up for this program aren't getting the care, the dental care. And California is kind of a patchwork quilt of access to this program, none of them in a particular county. What do you want to do about it? I know you're asking the Hoover Institute to look at this. What are you going to do about this in terms of the concern and the issue?
Well, our state's Denti-Cal program is broken. I was actually at a CDA Foundation event called CDA Cares over at Cal Expo. And so they have a bunch of dentists and their staff come in providing free dental care. Right? This is for people who can't get dental care anywhere else. Free dental care. And many of the people who are waiting in line for hours and hours and hours out in the hot Sacramento sun were people who had Denti-Cal. They had Denti-Cal, but they could not find anyone to take care of them. And certainly the auditor's report showed that people were having trouble accessing dental care. dental care, and also that there were a few dentists who were actually taking care, and that there was poor oversight by the agency that oversees the dental program. So we've asked the Little Hoover Commission to look into this as well and to look more broadly at it and also hopefully come up with some recommendation solutions. The state of California needs to keep its promises to the people on Denti-Cal. We need to be sure that people who have Denti-Cal can get the dental care they need. And that's a commitment that we made, and we should honor that commitment.
Great. Just a final look at a couple of bills here before we wrap up that you're looking at here, particularly for the Sacramento community, but one that affects some other communities. The bill the governor signed regarding the beer bikes, the quadricycles in certain communities, and also flood control in Natomas. Now, I never thought I would put beer bikes and flood control in one conversation, but just briefly, these are two issues that affect Sacramento in particular. Tell us about those two pieces of legislation, 530 and 144.
So the city of Sacramento approached my office about saying that we need to have standards for safety for these beer bikes or quadricycles. And so I was happy to work on a bill to actually establish safety standards. We worked with law enforcement around that. And also to ensure that these amenities, because it's a great way for people to get around, a green way to get around, right? Doesn't use any pollution, it's actually exercise. Something that would actually be able to be a positive amenity in the community, help promote our Farm to Fork efforts here as well. Many other cities have used them successfully, but there haven't been any safety standards. And so what we did is we established safety standards to be sure that they operate appropriately, and also they have to be approved by the city in which it happens. So you can't just open that in any city in California. You actually have to get approval from the city. So it creates an option for cities that want to allow these quadricycles to operate in their city in a way that can help promote local businesses and as a positive amenity to the community. And then also, of course, flood control. I mean, we're in a drought, so people are like, well, floods. Well, we're waiting for a strong El Nino, whether it gets up here or not. But here in Sacramento, flood is certainly a major issue. We are a low-lying community. We have levees that help keep the water out. And if there's a lot of warm rain coming up and that comes pouring down the Sacramento River and Americans rivers, we need to be sure that we can keep our communities safe. And so that requires that we maintain and also upgrade our levees. And so this legislation that I did pairs up with federal legislation as well to ensure that we can continue the work on the levees to strengthen those levees and keep our community safe.
Great. Thank you so much for talking about this. I know 2016 is going to bring a lot for you for legislation. I hope to have you back and talk about it. I know it's been an extraordinary year for you in ways you probably didn't imagine, but I'm glad we could be here to talk about it and everything that you've done. So thank you very much.
Well, thank you. We got to keep everyone safe and healthy.
Great, great. Thank you very much. Dr. Richard Pan is our state senator from Sacramento here, and that is this edition of Senate Spotlight. Please join us next time around as we discuss important legislative issues and policies with the newsmakers and newsbreakers, and you're definitely one of those, here at the California State Senate. From the state capitol here in Sacramento, I'm Brian Green. Thanks for watching.
Thanks for watching Senate Spotlight.